Hi, everyone. My name is Jessie Tong. I'm assistant professor of biostatistics from Johns Hopkins. And it is my great honor to present our recent publication on NPJ digital medicine. And so when we conduct multi-site international study, a primary challenge is that infeasibility to share patient-level data. And given the regulatory approval process and also the diverse laws across the different countries, and also the different institutional policy restrictions, sharing patient-level data becomes more and more hard and difficult, right? So here we're thinking, why not we use like an algorithm to help deal with such challenge? And here the privacy-preserving federated algorithm becomes a solution. And such algorithms help us to fit the statistical model or even machine learning model in a federated manner, and without requiring sharing patient-level data. Such algorithms only require each collaborating site within a network to share their summary-level statistics to a coordinating center, and then the coordinating center can take the lead to fit the models. And such procedure, you can tell, it ensures the data privacy and also the security. And when we apply a method, especially the federated learning algorithm in practice in a real-world setting, there are two ideal properties we need to keep in mind. The first property is called lossless, which means that the federated learning analysis is ideally to be identical as the results if we can get from a pooled analysis. And here the pooled analysis is the benchmark, which refers to the ideal setting if all of the participating sites can share their patient-level data and form a data warehouse. However, as I just introduced at the very beginning, in a real-world setting, especially the international collaboration, the sharing of patient-level data is really challenging. So here, that's why we want to develop the lossless federated learning algorithm and to ensure that there is no accuracy loss due to the data sharing constraint. And another property is called one-shot, which means that we want to reduce the communication cost and save the human in the loop efforts. So we want to develop the federated learning algorithm only requires a single round of communication for each collaborating site to share their summary level statistics to the coordinating center. However, to date, only a few algorithms have successfully achieved both lossless and one-shot properties. One is linear regression model, and the other is the linear mixed effect model. And you can see both of these algorithms are focusing on continuous outcome. But in real-world setting, when we deal with observational data, the EHR data, or claims data, the outcomes types are beyond continuous outcome. We'll have binary outcome, categorical outcome, even time to event outcome. And also, when we conduct multi-site analysis, we need to develop a method to account for the between-site heterogeneity problem. So in this paper, we want to develop the federated learning algorithm for feeding the generalized linear mixed effect model. And such model allows us to model different types of outcomes, and at the same time, we can model the between-site heterogeneity through the random effects in this model. And in the past few years, there are some existing work on developing federated version of GLMM. For example, back in 2020, there was a paper published on biomedical informatics. They proposed to use the EM algorithm for feeding GLMM. However, since the EM algorithm is an iterative algorithm to get the parameter estimated, so it turns out like this federated version of GLMM is also iterative, which means that it requires about 500 to about 1,000 rounds to converge. And you can see it is really hard to apply this algorithm in a real world collaborative environment because we need to ask our data partners to share some intermediate results for 500 to 1,000 rounds. So this is really challenging in real world setting. And about 2 years later, there was a paper published on JAMIA. They proposed to use the penalized quasi-likelihood method for feeding GLMM. And the good thing about this method is that it achieves the lossless property. But the downside of this method is that it cannot achieve one shot because the penalized quasi-likelihood method is also an iterative method. Though it only requires less than 5 rounds, it's still an iterative method to make the parameter estimated. And then the same year, another paper called the FAT GLMM was proposed. And this method used approximation method, which is they use the surrogate likelihood method to approximate the global likelihood. And you can tell this is approximation and not lossless. And also the number of communication rounds really depends on if we need a initialization step or not. So in this paper, we proposed our COLA GLMM, stands for Collaborative One-Shot Lossless Algorithm for Generalized Linear Mixed Effect Model. And here, suppose we have a common set of covariates available at all collaborating sites, and these variables have been standardized into categorical variables. And the pipeline of COLA GLMM is that each site will use their patient level data to generate their own summary level statistics. For example, we have a individual patient level data, 2 indicators, one for female, the other for age. And then the summary level statistics to be calculated will include the combinations, the number of patients corresponds to the combinations of these 2 indicators, and also some calculation for the data. And once each site has such summary level statistics, they can transfer them to the coordinating center, and the coordinating center will take their responsibility to fit the GLMM model and estimate the parameter we're interested in. And that's how this COLA GLMM works. And to further protect the privacy and to deal with the semi-trusted environment where the data contributors and the coordinating center, they are following the protocol without engaging any harmful action. However, we cannot guarantee that the coordinating center may still trying to derive something from the summary level statistics each coordinating center share with them. So we developed this homomorphic encryption version of COLA GLMM. And for the sake of time, I won't go dive into this method, but we have more details in our paper. Okay, to demonstrate the performance of our COLA GLMM, we run some simulation studies. And from this figure, you can see it shows the lossless property compared with the pooled analysis. And also we deal with the rare cells issue, which means that we set the threshold to make sure we won't share 2 sparse cells in our raw data. So you can see like the COLA GLMM can still preserve like the accuracy in estimating the parameters in our regression model. And finally, we apply our method in a real-world case by collaborating with the wonderful data partners within OHDSI Research Network. We want to identify the COVID-19 mortality risk factors over 3 different time periods, and we focus on the hospitalized patients, and we work with 8 data partners from 3 different countries to work on this federated learning method by using this decentralized research network. And finally, we identify 3 different risk factors that are consistently emerge as significant across 3 different time points. They are sex, Charlson Comorbidity Index, and also age. And by double check with like the existing literatures, we found that our results are consistent with the evidence. Okay, to summarize, in this paper, we proposed COLA GLMM, which is a lossless, one-shot, and only requires summary level statistics to achieve the data integration from multiple hospitals. And we applied it in the OHDSI Research Network. It demonstrated the scalability and applicability of our method. But finally, I want to thank all of the co-authors and data partners of this project. Thank you very much.